The period is not a negative thing. It's not an illness. It's not a sickness. It's not a disease. In fact, we as women are so blessed and are so lucky to be able to have the key to provide and procreate. My name is Dr. Deemah Salem. I am a consultant in obstetrics and gynecology, and I work at Genesis Healthcare Center in Dubai. Women make 50% of the world population. About half of those are menstruating. So if you look at global numbers, 26% of all mankind is actually menstruating. So for us to not talk about menstrual health, for us to not understand menstruation, is actually causing a disservice to mankind. Unfortunately, there's a lot of misinformation about menstrual cycles, about menstrual health. There's a lot of taboos that you hear about, a lot of misconceptions that happen, whether it be from cultural practices, religious beliefs, or just lack of education, lack of knowledge about it. And this can end up leading into very harmful practices, whether it be physical harm or psychological harm or even social harm. If we don't understand what normal is, we won't know what abnormal is. Without being educated about what menstrual cycles are, how it's supposed to work, what your periods are supposed to look like, what your periods are supposed to feel like, what the amount of the bleeding should be, that can end up leading to many women suffering because they just figure it's normal, or it's hushed. One of the misconceptions that, especially I think in the Middle East, we have about menstrual cycles is that menstrual cycles are considered to be a way to release toxins from the body, or a way to release impurities and dirt and filth from the body. So we get this impression just from society, from cultural practices, that when you have a period, you have to cleanse after it very well because you were in a state of impurity, physical impurity, medical impurity, which obviously is not the case. So women end up having habits or incorporating habits into their hygiene on a day-to-day basis that involve excessive cleaning to try to get rid of quote-unquote impurities or toxins from the body after having a period, that then may lead to harm. So it can cause irritation, infections, abnormal discharge, and many medical conditions that actually cause harm to the physical body. A lot of the menstrual products, they are actually not obligated to list all of their ingredients or all of the materials or chemicals that were used to make that product. So we get into a lot of products that may contain certain bleaching toxins, irritants, chemical irritants that are contaminated. We also get into products that may contain fragrances. And so there are certain products that will be fully loaded with some of these toxins and chemicals and fragrances that can cause dermatitis, contact dermatitis. We know this as a fact. A lot of women end up getting rashes and inflammation and irritation from constantly using a pad, for example, that irritates on the vulvar skin. The vulvar skin is very sensitive. And so with a lot of the contact dermatitis that we see, we have to treat those sometimes. That may lead into infections. But what is important in a general way is to try to eliminate products and not use products that have obvious use of chemicals, toxins, especially fragrances. And so things that are scent-free or don't have a scent on them, those are the ones that we would usually recommend to use. In order to have the best menstrual health, we have to fulfill these 4 categories. First and foremost, number 1, education. And what I mean by that is educating all women, all girls, all females that are menstruating about their menstrual cycles, to learn about what the menses is, to learn why it happens, why it occurs, how it occurs, from the biologic, physiologic, physical perspective, but also incorporate spiritual, religious, mental aspects to the menstrual cycle. The second category being able to care for the body, physically, hygienically, but also mentally during the process of having a menstrual period. To be able to care for their bodies, to have fresh water, supply of water, to be able to cleanse themselves, to have access to all menstrual products, for them to have the ability to choose what's the most convenient, to have the support, to have privacy. The third category is to be able to seek help. And that is very important because a lot of societies, women are kind of shunned away from seeking help, whether it be medical professional expertise in regards to their menstrual cycles, because whether it be maybe they haven't gotten married yet, or they're teenage girls and they're not supposed to see a gynecologist, or whatever the reason may be. And then the fourth category that's important, that makes up the definition of menstrual health, is to eliminate all discrimination, to eliminate the shame, to eliminate the stigma associated with having a period, to be able to have women to freely be confident with their bodies during their menstrual cycles, be able to have opportunities in the work field, in social gatherings, religious gatherings, whatever it be, for them to not feel discriminated against because of their menstrual cycle. The period is not a negative thing. It's not an illness. It's not a sickness. It's not a disease. In fact, we as women are so blessed and are so lucky to be able to have the key to provide and procreate. We have uteruses in the body that provide that function to be able to get pregnant and to have offspring and to procreate. And if you didn't have a menstrual cycle, you wouldn't be able to do that. Mankind would be extinct. So in order to have all of that happen, you have a menstrual cycle. And that is a positive thing to educate girls about instead of shaming them for having a period. I think that's pretty much it.